This webinar aims to inform how health visitors can influence their local joint strategic needs assessment, and it's brought to you by the Institute of Health Visiting as part of Making the Most of Health Visiting programme, which was designed to support health visitors' continued professional development. The Joint Strategic Needs Assessment, or JSNA, is a process which includes a framework that identifies the current and future health and wellbeing and social care needs of a local population, allowing commissioners to identify priority areas to improve outcomes and reduce inequalities in health. The JSNA process brings together several pieces of work, including local health statistics and outcomes analysis. It identifies gaps in knowledge and local information and provides an overview of local service provision. It draws on evidence of what interventions work and whether interventions provide value for money. And importantly, the JSNA brings together views of patients and public through community engagement. And finally, the process maps and analyses community assets. Local authorities and clinical commissioning groups, or CCGs, have equal and joint responsibilities to prepare the JSNA through their local Health and Wellbeing Board. The responsibility falls on the Health and Wellbeing Board as a whole, and so success will depend upon all of its members working together throughout the process. Who sits on a Health and Wellbeing Board? Well, at least one counsellor and a number of directors, including the Director of Public Health, Adult Social Care and the Director of Children's Services. At least one representative from each relevant CCG and at least one representative of Local Health Watch. Gathering data in one place is just one part of the overall JSNA process. Analysing this data to build intelligence, inform priorities and drive change is essential. The JSNA process includes several types of data, including population level data, social and place data. It looks at lifestyle determinants of health and health inequalities. It looks at epidemiology and whether practice is evidence-based. And importantly, it looks at community perspectives, which includes the views and expectations of service users. Once data has been collected for the JSNA, it is then used as a basis upon which to negotiate and agree the overarching priorities for the health and wellbeing strategy. The health and wellbeing strategy should explain what priorities the Health and Wellbeing Board have set in order to tackle the needs identified in their JSNA. This should then ensure that we have commissioned services that identify and address local needs. Addressing determinants of health and the identification of health needs at both individual and community level has always been a core element of the health visitor role. And although the Principles of Health Visiting were first published in 1977 and have been revisited several times since, they still continue to underpin health visiting training and practice. So as health visitors, we still search for health needs. We stimulate an awareness of health needs both at the individual and community level. We influence policies that affect health both locally and nationally. And we facilitate health-enhancing activities. As health visitors, we play a crucial role in supporting coordinated and integrated services for children and families that are tailored to local needs. When assessing the individual needs of families, as health visitors, we should use this information to build a much bigger picture of the local community needs. I suppose this is the challenge for health visitors, as how then to share this local intelligence and inform the JSNA. How as health visitors can we further contribute towards this process? In 2014, Hussaby identified 5 key messages to ensure quality commissioned services. We can use these messages to contribute towards the JSNA process. Firstly, listen to the voice of parents and service users, and we should include the voice of the child. As health visitors, we triangulate data and local intelligence to inform the process. Working within community level means that as health visitors we can identify the strengths and contributions that our community can make, allowing us to identify levers that often remain hidden to other agencies. We should assist commissioners to walk the service and improve their understanding of the reality of data. And finally, we can share concerns of families and communities and then support and empower them to take action. So as health visitors, we have a significant contribution to make in providing local intelligence to inform the JSNA about population need, to improve the lives of individuals, families and communities that we work in. So ensure that you collect the right data to identify the needs of your population and then share this data with your Health and Wellbeing Board to inform your local JSNA and your health and wellbeing strategy. This webinar is brought to you by the Institute of Health Visiting. Thank you for listening.